So moving on to the second important reaction in glycolysis, and that's going to be the conversion of fructose 6-phosphate to fructose 1,6-bisphosphate. And this is going to be catalyzed by the enzyme phosphofructokinase. Now remember that kinase is just an enzyme that adds a phosphate, so we're just going to add a phosphate to the first carbon on fructose. And during this process, there's going to be consumption of ATP. Now, it's important to know that phosphofructokinase is going to be the rate-limiting step in glycolysis. So it's important to understand what inhibits this enzyme and what induces it. So inhibitors of phosphofructokinase are going to be elevated citrate levels and also elevated ATP levels. Now, these both are going to indicate a high energy state inside the cell. That means that there's no need to push glycolysis forward in order to produce more ATP because the cell is already in a high energy state. Now, to understand this better, citrate levels are actually a byproduct of the TCA cycle. And of course, the TCA cycle is going to produce ATP. So the higher the citrate levels, that means the higher ATP that is produced by the TCA cycle, meaning the higher the energy state. And this is why citrate levels inhibit phosphofructokinase. Now, inducers of phosphofructokinase are going to be low AMP levels. Of course, this is a byproduct of using ATP, and this indicates a low energy state, and also increased levels of fructose 2,6-bisphosphate. Now, fructose 2,6-bisphosphate can control basically the phosphofructokinase. So it's important to understand how this happens, and we're going to discuss this in the next few slides. Okay, so now we're going to talk about how fructose 2,6-bisphosphate influences the process of glycolysis. Okay, so in the previous slide, we talked about how fructose 6-phosphate is converted to fructose 1,6-bisphosphate by the enzyme phosphofructokinase 1. Now, this is a reaction in glycolysis. Now, the reverse step, which is the conversion of fructose 1,6-bisphosphate to fructose 6-phosphate, is catalyzed by the enzyme fructose bisphosphatase 1. Now, this is a reaction in gluconeogenesis. Now, both of these reactions are going to be the rate-limiting steps in both glycolysis and gluconeogenesis. So where does fructose 2,6-bisphosphate come from in the cell? Well, it's going to be converted from fructose 6-phosphate by the enzyme phosphofructokinase 2, and it can be converted back into fructose 6-phosphate by the enzyme fructose bisphosphatase 2. And these are the same enzymes that are here, but they just have a number 2. So the activity of these two enzymes will ultimately dictate the level of fructose 2,6-bisphosphate in the cell. Now, fructose 2,6-bisphosphate is the on and off switch for glycolysis, meaning that a rise in fructose 2,6-bisphosphate will induce the enzyme, or a rise in fructose 2,6-bisphosphate will induce glycolysis, and a fall in fructose 2,6-bisphosphate will inhibit glycolysis. So if there's an increase in fructose 2,6-bisphosphate, this is going to induce the enzyme phosphofructokinase 1, and it's going to push the reaction towards glycolysis. If there's a decrease in fructose 2,6-bisphosphate, then it's going to inhibit the enzyme phosphofructokinase 1, and this is going to push the reaction more towards gluconeogenesis. So what influences phosphofructokinase 2 and fructose bisphosphatase 2 to either increase or decrease the levels of fructose 2,6-bisphosphate in the cell? And the answer to that is going to be insulin and glucagon. So insulin and glucagon can affect the activity of these two enzymes, and this is going to, in turn, affect the levels of fructose 2,6-bisphosphate that are going to influence the process of either glycolysis or gluconeogenesis. Okay, so now we're going to talk in a bit more detail on how insulin and glucagon affect the process of glycolysis and gluconeogenesis. So insulin is a hormone that is released after a meal. That means that it's released during when glucose levels are high in the blood. This means that insulin is going to promote the process of glycolysis because we have abundant glucose in our system. So insulin's net effect is that it's going to induce the enzyme phosphofructokinase 2. Induction of this enzyme is going to lead to an increase in the levels of fructose 2,6-bisphosphate. Fructose 2,6-bisphosphate is then going to induce the enzyme phosphofructokinase 1, and this is going to promote the process of glycolysis. Now, on a cellular level, what happens is that after a meal, of course, someone's insulin level is going to increase. Now, when insulin binds to its receptor, it's actually going to inhibit adenyl cyclase, and this is going to lead to a decrease in cyclic AMP and decrease in protein kinase A. Now, protein kinase A is an enzyme that phosphorylates everything. So if you have a decrease in activity, that means it's going to lead to the dephosphorylation of other enzymes. So it's going to lead to the dephosphorylation of phosphofructokinase 2 and fructose bisphosphatase 2. Now, the dephosphorylation of these two enzymes has a different effect on them. So the dephosphorylation of phosphofructokinase 2 is actually going to lead to an increase in its activity, and the dephosphorylation of fructose bisphosphatase 2 is actually going to lead to a decrease in activity. So the net effect is that there's going to be an increase in the activity of phosphofructokinase 2, and this is going to lead to an increase in fructose 2,6-bisphosphate. And of course, when you increase fructose 2,6-bisphosphate, it's going to induce phosphofructokinase 1, and it's going to stimulate the process of glycolysis. Okay, now on to glucagon. So glucagon is a stress hormone, and it's going to be released during the fasting state. So it's going to be released during a state where there's low glucose in the blood. So the net effect of glucagon is that it's going to induce the enzyme fructose bisphosphatase 2. So it's going to induce the enzyme that converts fructose 2,6-bisphosphate back into fructose 6-phosphate. So it's going to lower the levels of fructose 2,6-bisphosphate. And when you lower these levels, you're not going to induce phosphofructokinase 1, and this is going to inhibit the process of glycolysis and induce the process of gluconeogenesis. And of course, this makes sense because when there's low glucose in your blood and it's in the patient or the person is in the fasting state, you're going to want to induce your cells to start the process of gluconeogenesis. Now, on a cellular level, what happens in glucagon is that it's going to bind to its receptor, and it's going to induce adenyl cyclase. Now, this is going to lead to an increase in cyclic AMP. It's going to lead to an increase in protein kinase A. Of course, protein kinase A is then going to go and phosphorylize these two enzymes. And like we said before, the phosphorylation of these two enzymes has different effects on them. So the phosphorylation of phosphofructokinase 2 is actually going to lead to a decrease in activity, and the phosphorylation of fructose bisphosphatase 2 is actually going to lead to an increase in activity. So when you have an increase in the activity of fructose bisphosphatase 2, you're going to decrease fructose 2,6-bisphosphate in the cell, and so there's going to be no induction of phosphofructokinase, and this is going to promote the process of gluconeogenesis. So the third and the final important reaction in the process of glycolysis is the conversion of phosphoenolpyruvate to pyruvate, and this is done by the enzyme pyruvate kinase, and there's going to be a production of one ATP molecule. So the inhibitors of this process are going to be high levels of ATP, and of course because it indicates a high energy state, so we don't need to produce more ATP, high levels of alanine, which we'll get to in a bit, and also glucagon and epinephrine. Now remember that glucagon and epinephrine are stress hormones, so they're gonna induce the process of gluconeogenesis and not the process of glycolysis. Activation of this enzyme is done by fructose 1,6-bisphosphate, and it's called feed-forward activation. Why is it called that? Well, this is fructose 1,6-bisphosphate, and when it gets formed during the process of glycolysis, it's going to come all the way down here and stimulate pyruvate formation. So it's going to stimulate the enzyme pyruvate kinase. This is why it's called feed-forward activation. Okay, so now let's discuss how elevated levels of alanine inhibit pyruvate kinase. Well, in order to understand this, we need to understand something called the alanine cycle. So imagine this as a muscle cell. So during rigorous or prolonged exercise, if your muscles run out of glucose, they could actually begin using amino acids or protein in order and use it for energy, and in the process it's going to form alanine. Now alanine can go all the way back to the liver, which is something called the alanine cycle, and be converted back into glucose. Now when alanine reaches the liver, it's going to inhibit the enzyme pyruvate kinase, so it's going to stop the process of glycolysis in the liver. And the reason why it does that, because alanine indicates that there's low glucose levels in the muscle, and that the liver needs to begin the process of gluconeogenesis in order to supply the muscles with more glucose. So an important clinical correlate is pyruvate kinase deficiency. So this is an autosomal recessive disease in which there's a deficiency in the enzyme pyruvate kinase. Now, patients who have this deficiency cannot convert phosphoenolpyruvate to pyruvate, and they cannot produce ATP in this process. Now, this usually affects RBCs because RBCs are dependent on glycolysis for ATP. They do not have mitochondria. So RBCs are going to have a decrease in the levels of ATP, so they're not going to be able to maintain their membranes. So this is going to lead to abnormal RBCs that are going to get phagocytosed inside the spleen, and these patients could also have extravascular hemolysis, and this usually presents in neonates. So pyruvate is going to be the end product of glycolysis, and this is a very important molecule. and it could take multiple other pathways inside of the cell. So one of the most important pathways is that pyruvate can be converted to acetyl-CoA in the presence of oxygen. Acetyl-CoA can enter the TCA cycle to produce more ATP. Okay, so if there is no oxygen inside, low oxygen supply to the cell, pyruvate cannot enter the TCA cycle. So pyruvate is then converted to lactate by the enzyme lactate dehydrogenase, and in the process, it's going to produce an NAD+. So it's going to convert NADH into NAD+. Now, why is this very important? So if you go back to our glycolysis pathway, we can see that during the glycolysis pathway, we actually consume an NAD+. So it's very important to maintain adequate levels of NAD+, which is vital for the process of glycolysis. Now, if tissue enters a hypoxemic state and it can't enter the TCA cycle, so it can't regenerate its NAD+, then there has to be another way to regenerate this NAD+, and this is by the conversion of pyruvate to lactate and the regeneration of NAD+. So a few important clinical correlates. So lactic acidosis, and this is basically elevated levels of lactic acid inside the blood. This is going to be due to low O2 supply to certain tissues. There's going to be an increase in lactic acid production because all the pyruvate is going to shift towards lactate instead of the TCA cycle. And this is going to lead to an elevated anion gap, metabolic acidosis, low pH, and low bicarb. And this happens in cases of sepsis, bowel ischemia, and also seizures, in which there is basically severe muscle contraction, and that's going to lead to muscle hypoxemia and lactic acidosis. Muscle cramps is a more common clinical correlate. What happens here is that there's going to be prolonged and very vigorous exercise, leading to decreased O2 supply to muscles, leading to increased lactic acid production in muscles. This is going to lower the pH in muscles, and that's going to lead to the cramps that some athletes get.